And you're welcome back to the Pulse. Now, earlier you heard from the Ghana Health Service indicating that the COVID-19 pandemic is not over. In furtherance of that, the Greater Accra Regional Health Directorate has been scaling up its efforts to ramp up the numbers in terms of the vaccination exercise. Fortunately, we've been joined now by Eunice Jagli, who's the PRO for the Ghana Health Service, also to tell us about the national strategy and also what's been done in the national capital, which is obviously leading the charge in terms of infections. Thank you, Eunice, for your time here on the Pulse. So it appears that after the relaxation of the COVID-19 protocols, many are not even concerned about the virus any longer. Has that gotten to your tables at the Ghana Health Service?
Thank you. I wouldn't say officially that is on our table, but we all can see the response in the system as to how people are going about issues, and especially the response we had with the vaccination. The apathy and hesitancy shows that people are feeling as the government or the president had relaxed the observance of the protocols, it means COVID is gone, which is not true. The fact is, when we were masking up, the protection was even higher for individuals because majority were masking up. Protection is for those masking up and those around them. Now that we have stopped the masking up, it means that we are all at a higher risk. And the worst of it is we have not yet reached a vaccination point where we will say the system had developed what we call herd immunity, an ideology that proves that when a majority are vaccinated, the protection they have protect the few that are not vaccinated, which means in the system we are talking about 95% of our target population for the vaccination. When they vaccinate, then we know the few that have not vaccinated can take cover with the majority. But as we speak, out of the over 30 million Ghanaians we have, we can only boast of about 30 million to 40 million people vaccinated. That tells you that the number vaccinated, at least taking one dose, the number vaccinated is far too low for us to relax and feel we are okay to go and then we are protected. So yes, the realization had come on the observance of the protocols, but we still have cases of COVID. And you and I knew the COVID started with 2 persons, and we had a lot of story to tell. And those who love loved ones, those who experience the COVID themselves will tell you it's a serious issue. So we all need to vaccinate to ensure that we get ourselves protected as well as our families protected. And if you look at it from this angle, then the numbers that are vaccinating, and especially the response during this just ending national vaccination, is an issue to worry. It means, therefore, that we still have a larger population not protected. And if there should be an outbreak again, then there will be problem for us to handle. I think that is the concern the Director General has, to encourage us to go back and get ourselves vaccinated.
But when the announcements were made by the president, clearly a lot of people felt it's now a case where obviously infections had gone below the line, which could bring back the contagion. So what's accounting for instance, that situation where we have people not going out willingly to take the vaccinations and to adhere to the other protocols that were laid out?
Can you please come, Claire? I didn't hear you well.
Yeah, so I was talking about the relaxation of the protocols. Obviously, when it was announced by the president, the belief was that the infections had gone below the line. And I guess that's what was accounting for the carefree behavior of many out there.
Yes, it's true that the announcement, people felt then it means we are out of the woods. But then the fact is that we started with 2 cases, and then we struggled. So if we still have cases, it means therefore that we still have a situation at hand to handle. I think the president was being kind to us to ensure we move about our work with precaution. That is why at the end of that statement, he mentioned we should all go for our vaccination, because he knew very well that when we go for the vaccination, we'll be protected. So he wants us to be productive. He wants us to be around to do what we can do to support the system and ourselves. And he wants us to take the needed protection in the vaccination. I think that is why the government had done all it could to ensure we have the vaccine in country for everybody to be vaccinated. So if all has gone into getting the vaccine in, and we have refused to take the vaccine, then the support the government want to give us to ensure that we get the needed protection and go about our daily duties and get productive will not be fulfilled. So it is left to us as individuals, as family members, as friends, to ensure that we go to do the vaccination ourselves. We get the friends we have around, the family members we have around to go and vaccinate. I heard people talking about they had the first jab and they felt sick, fever, weakness, and so on and so forth. But I want to use this opportunity to tell all those who are listening to us that shows that the vaccine is working, because every vaccine, as we know, is to sensitize the body for the body to develop the needed immunity. And what the vaccine does is to bring about the symptoms of the condition that you are being vaccinated against. So the body will now develop the needed immunity. So when the real disease comes, the body had already prepared and will be able to fight and overcome. So those who had the jab and had those conditions and felt as a result of that they shouldn't go in, they were the people developing the best immune, and they were now shying away from the vaccination. So they should go and take the subsequent one. That will complete the process they have started to build the immunity to protect themselves and to protect others.
And
we are saying that,
and I guess at this point, the concern at this point, access. Where are the centers you've created, and how accessible are they to the general public, particularly here in the Greater Accra region?
Almost every government facility has a vaccination point. So when you walk to every government facility, you have access to the vaccine. And we have some private facilities too, where we usually do such a program. When you go to those facilities too, you get your jab. And if you go and there is no vaccinator at the point, they will direct you to the nearest place to get your jab. And I think they are accessible more than you can imagine. You shouldn't walk beyond a reasonable distance to get a vaccination point to vaccinate.
So there's the question about pregnant women, the controversy surrounding whether or not they are eligible in this process that you're running now. What do you have to tell such persons who are pregnant or perhaps lactating mothers as well?
Thank you. Pregnant women are eligible to take the vaccine. Data reveal that it has no side effects on the baby or the fetus. So pregnant women can take all the vaccines now. Lactating mothers can take them, and it will have no harm on them or the unborn baby. So they are all encouraged. It's even rather they that needed it, because data from our system show how pregnant women were suffering and how it affected the pregnancy. So when you go and protect yourself with the vaccination, you protect the unborn baby too, and you make the period safer for you, so you don't get contracted and now struggle to see how to protect the baby and yourself. So the vaccination is the best option for pregnant women as we speak when it comes to COVID-19.
And are you also reviewing the age bracket that can go in for the vaccination?
The age bracket,
Yes.
We started from 18 years, but now we are including from 15 and above. So everyone from 15 years and above will go for vaccination. So if you turn 15, you can go for your vaccination. If you have taken your first jab and you have not gone for the second one, and it is more than 4 weeks, you can go for your second jab. If you have taken your mandatory jabs, then you have to go for the booster, just to make sure you develop the needed immunity for your protection and the protection of your family.
And there are concerns also about preference for single dose vaccines. For instance, the Johnson & Johnson, as we understand, is a single dose vaccine. The concern is that due to that preference that we have from the general public going in to be selective about the type of vaccine they're taking, it's also affecting your operations. How so?
Thank you. Now, we have the Johnson & Johnson, we have the Pfizer, and we have the AstraZeneca. They are all in the vaccination centers. So if you go and you have a preference among these three, nobody will prevent you from taking them. So we have at least 3 for anyone who have preference to choose from. So I don't think preference should be an issue now for anybody to avoid the vaccination. We have it. So they should come out and take it for their protection.
Finally, ever since you stepped up the vaccination process, how would you describe the exercise so far? And what do you have to say about how the public is receiving your decision to go out there to expand access to the various vaccination centers?
The vaccination had been on for a long time now, since March last year. But for the national campaign, that is what we are doing now, which is the second round of the national campaign, that is to make available the vaccine to everybody, wherever you are at hot time. The previous one was better than what we are experiencing now. Some of the concern that we received was our friends, the Muslims. Some are complaining they are fasting, so they wouldn't take the vaccination. But in fact, I came across a release from or a document from the Muslim community or the clerics who are saying that you can still take your jab whilst fasting. So to my friends, the Muslims, please, we understand you can still take it. That is also a factor that is affecting the turnout for the vaccination. And besides that, people, for reasons that are not something that should prevent them for maybe not getting the right understanding or explanation to concerns they have, are also shying away from the vaccination. So the turnout actually is not the best, it's not encouraging. That is why we want to use all avenues to encourage everybody who are taking first, who have not taken at all, who have finished the mandatory, to all go back and take their vaccination, so that at the end of the day, we can get 95% of our population, target population, vaccinated. When it gets to that point, we can all live a free life and be happy and be productive and work together to build better Ghana for ourselves.
We have currently 40 active cases. What's the projection going forward? What's the projection like? Are these people severe patients, or they are likely to recover very quickly in the coming days?
Thank you. Sometimes it's not just ABCD to say we can say they will recover, they will not recover. It depends on a number of conditions. So what we are concerned about now is not to have people in that situation. So to prevent that from happening, for us to think of what to be their condition in the next few weeks or days, we would rather prefer to talk about those who have not vaccinated to go and vaccinate than speaking to those who are already in the condition, and we are trying to see what we can do to help them overcome and get healthy. So I think that is even what we should be concerned about, that if we have 40 cases now, it means if we don't do the right thing, we may be in trouble, because we started with 2 cases. I continue to stress on that. We started with 2 cases and it was an issue. So if we have 40 active cases, that tells you we can run into trouble if we don't do what is right by vaccinating, getting sure we vaccinate and get our families and friends also to vaccinate.
All right, then. We'll have to leave it here. Eunice, thank you so much for spending some time with us this afternoon.